It's a Northwest lifestyle weekend on Como News. Now back to IRG's Health Talk.
All right, our next guest, Dr. Carley Squires, naturopathic physician from Balanced Medicine Clinic. Neck pain. You've heard the old saying, you're a pain in the neck? Well, there's very real science behind that. Let's talk to Dr. Squires with Shannon O'Kelly.
Carley Squires, welcome to Health Talk. You're a naturopathic physician. Tell our listeners about your practice.
Yeah, so I'm at two locations, Balanced Medicine Clinic and the Center for Healing Neurology. So I'm a naturopathic doctor that specializes in musculoskeletal pain and neurology.
Musculoskeletal and neurology. That leads us right down into our first question, which is, what about chronic neck pain? Particularly, as a physical therapist, we've dealt with whiplash and the effects of whiplash and the long-lasting effects of whiplash. Let's talk about whiplash from an anatomical, physiological standpoint, kind of mechanism of injury and what's going on there. And then we'll get into some treatment. How about that?
Yeah, that sounds great. Yeah, often, we could use a car accident, for example. Our neck gets forced forward and backward, and then we get ligament sprain. The ligaments get stretched out. Oftentimes, they can be healed with PT, physical therapy, acupuncture, chiropractic, just rest. Sometimes, though, that trauma to the neck, our body can't create an appropriate reaction to heal it. And so oftentimes, years later, people will still be experiencing pain from these whiplash injuries from car accidents.
Yeah, let's talk about the mechanism, because the word whiplash pretty much describes what's going on here. But a lot of times what happens is either you're rear-ended or you're hit T-boned or even on the front side. But ultimately what's going on is violently your head is being flung forward or backwards or side to side, taking those soft tissues, ligaments, tendons, muscles beyond the normal range of motion that they're used to, and you stretch them out. In a muscle situation, it's a strain. In a ligament, it's a sprain. But it's violent whiplash, and there's nerves, tissue. It's a complicated area. It's your neck, right?
Yeah, yeah.
So crazy stuff can happen.
Yeah, exactly. And so that prolonged chronic inflammation, the body can't fully heal it. So the ligaments are stretched out, so the muscles are trying to stabilize an unstable joint, so they're getting really tight, and then you're losing range of motion. You could create further inflammation that could lead to degeneration like osteoarthritis and things like that.
Right, and all you have to do as a patient is experience this one time, and then you have a total appreciation of your neck and the complexities, just the lack of movement or not able to move. And then when those muscles, they go into this protective guarding mechanism, what we call splinting and guarding, and then they become restricted and you get myofasciitis or trigger points or tension and those headaches. I mean, it's a violent cycle.
Yeah. Like you said, there's other effects, headaches, you could have dizziness, vertigo, you can have ringing in your ears, you can have balance problems. So it can be very intense.
Yeah, and that's a really good point. I was just going to mention over the years, I've seen several patients with whiplash, and they do have vertigo. I mean, it's this traumatic onset of vertigo and that dizziness and nausea. I mean, that's a terrible feeling. If you've ever been nauseated or dizzy at the same time, it's not good.
Yeah, it is not fun.
Yeah, exactly.
And so there's therapies that we can do if the conservative treatments like physical therapy, acupuncture, chiropractic, if those things aren't working, there's regenerative medicine injection therapies that essentially, like we talked about, there's this low-grade inflammation going on. The body can't mount enough of an immune and inflammatory response to heal the tissue, to heal that chronic strain and sprain. So you can use different injection therapies to stimulate the body to say, hey, we haven't healed this area yet. Let's come here. Let's bring our immune cells. Let's bring our growth factors, our collagen building precursors, and let's heal this tissue. And it can be very effective for these chronic patients that just don't seem to get any relief from anything.
Yeah, it's interesting as you talk about that, and particularly for our listeners, I always want to try to set it up. I know we're on the radio and, moving our hands here and talking, but it's physiology, it's anatomy, and your body is essentially trying to repair itself. And sometimes it just gets bogged down. And those repair factors that are in your blood and trying to go to that area that's damaged, you're just trying to facilitate and enhance that.
Yes, exactly, because our body can get distracted, right? We're eating inflammatory foods, we are stressed at work, we are exposed to environmental toxins, hormonal imbalances. All these things can take our body in different directions, and then we forget to heal the injury.
Carley Squires, Shannon O'Kelly back next after this on Como.
It's a Northwest Lifestyle Weekend on Como News. IRG's Health Talk continues.
More with Dr. Carley Squires and Shannon O'Kelly on neck pain.
Carley, thanks for coming down and thanks for sharing your information regarding chronic neck pain, particularly whiplash. And as we left off the last segment, we were talking about your body attempting and trying to heal itself, because that's really what it wants to do, is heal itself. And you're trying to promote it or promote that healing process. But I like the fact that we're talking in today's world holistic approaches, right? Because, I mean, we know your body wants to heal, but you got to look at all systems and stress reduction, posture, body mechanics, nutrition. I mean, your body's a machine, right? And you have to keep the machine running smoothly. Any mechanic will tell you that. And that's what you and I really are. We're body mechanics, essentially. Tell us how you approach, from a holistic standpoint, musculoskeletal injuries, i.e. chronic neck pain, whiplash.
Right. So we have to look at proper structure. So that can be, getting proper body work, physical therapy, occupational therapy, looking at any kind of body mechanics, like you just said. We have to look at inflammatory foods. Do we have digestive permeability causing systemic whole body inflammation? We have to look at environmental toxins. So is our body detoxifying okay? We have to look at hormonal imbalances. We have to look at stress, meditation, mindfulness. All of those things can contribute to our whole body inflammation, which essentially will help heal any injury we have if we can decrease that.
It's interesting. I like the fact that you mentioned mindfulness. I mean, as clinicians, as people in medicine, I think sometimes, and speaking for me personally, I mean, you have a tendency sometimes to get focused on cause and effect, and we forget the soft skills sometimes, which is empathy, mindfulness, listening, talking, communicating. That's the stuff that we don't learn in school. Essentially, out of a book, we learn it with experience.
Yeah, and that can be so important to allow our bodies that innate ability to heal. We have to take those really simple things because they have big effects.
As a naturopathic physician working in musculoskeletal, you talked about diet and the importance of good diet. Real quick, do you have any ideas or any kind of recommendation on a good diet for people that are trying to heal from musculoskeletal trauma such as whiplash?
Yeah, I usually recommend a low inflammatory diet, which means, decreasing just processed foods, things out of a box, a lot of sugars. Big inflammatory foods are often gluten and dairy and corn and soy and sugar. So those ones, so if we can eliminate those, but everyone's different and everyone has their
right.
triggers. So just working with someone and trying to realize what are your inflammatory foods. But if we can just get back to eating more whole foods, less of those boxed foods, you'll do a great service.
Right. Just changing your diet sometimes, because what I think sometimes people don't understand is food can create inflammation and put your body in an inflammatory process. And reality is, when you're healing, inflammation is important early on in the healing process, but it needs to go away and it needs to stop. You don't want chronic inflammation.
Yeah, absolutely. I've seen just diet changes alone take away chronic osteoarthritis pain, so, it's powerful. The diet's very powerful.
Oh, it's huge. It's everything. And we're starting to realize that. That's what's kind of neat about being in healthcare today, is more and more providers are looking at the whole picture, which is diet, stress, interventional medicine, et cetera, et cetera. Thank you so much for your time, and thank you for joining us here on Health Talk.
Thank you.
All right, Dr. Carley Squires has been talking about neck pain. BalancedMedicineClinic.com for more information. Boy, we talk about the pain in the neck, and a lot of times that pain's just difficult to get rid of and difficult to figure out what it is.
You're absolutely right, Tom. It's the whole body. You have to look at the whole body, not just the neck. The whole body, ergonomics, posture, all that stuff needs to go into play with neck pain.
All right, thanks to Dr. Carley Squires. Again, if you'd like more information, BalancedMedicineClinic.com. Back with one more segment next on Como.